Hi, my name is Ken Cutbush. I'm a shoulder surgeon working in Brisbane. I'd like to talk to you about my preparation protocol to prevent infection when you're coming in for a shoulder replacement, either an anatomic or a reverse total shoulder replacement. So the incidence of prosthetic joint infection for total shoulder replacement arthroplasty is about 0.7 to 1.8% worldwide. My infection rate is much lower than that. We're well under 1%. Now, with revision total shoulder replacements, the infection rate is higher, generally quoted around 4% to 15.4%. That's worldwide. The infective organisms for a shoulder replacement are different to that for a hip or a knee replacement. It's a different spectrum of organisms. What we see in the shoulders is that there's more non-suppurative organisms. So these are organisms that don't cause a pus or pus reaction. So about 2/3 are non-suppurative, and that's quite different to the hips and knees. And 1/3 are suppurative organisms like a Staph aureus or a Cutibacterium. The non-suppurative organisms, the ones that don't produce pus, and the most common infective organism in the shoulders are Staph epidermidis and Propionibacterium acnes, which is now called Cutibacterium acnes. In the hips and knees, it's the other way around. About 2/3 are suppurative and 1/3 non-suppurative. So infection rates are increased if you have a lot of comorbidities, a lot of medical problems, diabetes, heart disease, and so on. We want to check your hemoglobin level preoperatively. A low hemoglobin, so that's often associated with iron deficiency, is associated with high infection rate. That needs to be identified, and we correct that preoperatively, usually with an iron infusion and waiting for your hemoglobin to come up, your blood cell count. Anesthetic risk is important. If you are medically unfit and you have an anesthetic risk score that goes up, that increases your infection rate. We want to look at your diabetes control if you have diabetes. And what we do is get an HbA1c preoperatively. We want that less than 7% before going ahead with a shoulder replacement. If it's higher than that, your infection rate is increased, and we don't want that. Things like depression, psychological depression, that increases your risk factors for infection, and of course, smoking and alcohol use. Now, it's been clearly shown that seeing a physician preoperatively reduces the risk of complications and is cost effective in terms of looking after you and for you yourself in terms of your treatment. Risk accumulates with each comorbidity. That's so that if you have, and a comorbidity is something like heart disease or diabetes or being obese, all of those medical issues, each of them increases your risk of infection individually. And so if we correct each of those issues or manage them optimally, then we decrease your risk of infection. Now, cortisone injections, we like to space the timing of surgery away from any cortisone injection you had. And we like that space to be about 3 months. It's been clearly shown from large databases in the United States that surgery within 3 months of having a cortisone injection has a measurable increase in the risk of infection. WHO guidelines recommend that the patients have a shower prior to surgery with an antimicrobial soap, that nasal decolonization be performed or certainly considered. We'll talk about that. We don't shave patients preoperatively anymore. That's done in theatre on the day of surgery. And we'd like to limit the number of people in and out of the actual theatre itself. Now, this is very interesting. So Staph aureus causes golden staph, and golden staph is a suppurative organism. It's quite an aggressive organism and it will cause a pus formation and the wound dehiscence or sinuses to form. It's very important that we don't get infections with Staph aureus. Now, the wound infections with Staph aureus, this golden staph, is associated with nasal carriage. It turns out that about 30% of us about 90% of us actually tend to carry Staph aureus in our nostrils, and 30% of us at any one time have it. Now, it turns out that surgical site infections are usually related to bacteria carried in the patient's nostrils. And that's been shown genetically, that there's a genetic similarity between the two Staph aureus. And that's not just for surgical site infections. Patients coming in for renal dialysis, and if they get a septicemia from Staph aureus, golden septicemia, then that almost always, in 80-90% of cases, has come from the patient's nostril. And that's done with genetic testing showing that link. It's really very interesting. Now, it turns out that we can eliminate the Staph aureus from the nostrils of patients coming in for surgery by giving them mupirocin ointment. So that's a bacterial ointment, and it's applied for 5 days, morning and night, and that is in preparation for the actual surgery itself. Not only does it eliminate from the nose, but it also appears to eliminate from our axillas and our groins as well, because they're also sites that Staph aureus can lurk and linger in. Now, we will ask you to do preoperative skin decolonization the night before, and we'll give you a chlorhexidine washcloth to use showering the night before surgery. And what that does, it just decreases the total bacterial load on your body coming in for the surgery, and certainly reduces the rate of surgical site infections. Now, in surgery, we will use chlorhexidine, our alcoholic chlorhexidine on the skin to prepare you, and that is the best thing to use for the surgical site preparation. But that's actually done in the operating theatre once you're anesthetized and asleep. P. acnes is something to talk about. Propionibacterium acnes is a bacteria that particularly affects shoulders. It doesn't particularly affect hips and knees. In fact, it's very rarely seen there, but it's very common. If you do get an infection, it's a common infecting organism in the shoulder. It's now called Cutibacterium acnes. It lives down in the hair follicles and it comes out onto the skin. So the problem is if we prep your skin with the alcoholic chlorhexidine and we clear it of any bacteria, after about 20 minutes or so, this Cutibacterium can come out onto the skin. So what we like to do is to give you a preparation that you use prior to surgery. So we use this for 2 days beforehand. It's benzoyl peroxide. It's just acne cream. It's not particularly expensive. It's safe and it's very effective in clearing out the skin pores of that Cutibacterium acnes. And so you just apply it. It's actually the biggest area is actually over the top of the shoulder. We ask you to use it in the axilla, but if it causes irritations, then in the axilla, then stop using it in your armpit. Just use it over the skin of the shoulder. You put it on and leave it on for about 15 minutes and then wash it off. If you're getting a reaction to it very early on, if your skin's sensitive, then just wash it off after 5 to 10 minutes rather than leaving it on for 15 to 20 minutes. And that should usually help with that problem. Your skin can get quite dry with it. So we do it for 2 days beforehand, so there's a total of 5 applications. So morning and night for the 2 days beforehand, and again, the morning of surgery. So there's very good evidence to support that seeing a physician preoperatively and getting checked out for any comorbidities or medical issues and getting them attended to is a good thing to do. It clearly decreases the risk of complications. It's cost effective as well. We don't want to find out that you've got medical problems on table under the anaesthetic. We want that sorted out beforehand. We don't like surprises in theatre, and it's not safe for you as a patient to have things like that undiscovered, because they will tend to come out at the time of the surgery, because it's significant stress on the body having a total shoulder replacement and having that anaesthetic. Nasal swabs, we like you to use mupirocin antibiotic ointment for 5 days before the surgery, morning and night. That will clear the Staph aureus from your nostrils and significantly reduce the risk of golden staph infections with the Staph aureus in your wound. We like you to use benzoyl peroxide for 2 days before the surgery. So it's 5 applications, morning and night for 2 days beforehand, and then the morning of surgery. And what that does is clear the Cutibacterium acnes or Propionibacterium acnes from the sebaceous glands, so that after we've prepped your skin and got ready for the surgery, it doesn't come out onto the skin after we've actually started doing the operation, because it's actually cleared from those pores. So it's very important to do that. And we like all of your long-term medical problems optimized. So diabetic control needs to be optimized. We want to know if you've got iron deficiency and anemia related to that, and we want that corrected. So that's an overview of my approach to preventing infection, or preparing you so we avoid infection as much as possible for a total shoulder replacement. I hope that makes sense, and I hope that reassures you about how we go about things.